Okay, welcome to the final week of the course. My name is David Robertshaw. I'm the lead academic for Bridging the Dementia Divide, and I'm joined this week by a familiar face now to most people.
Yeah, Pauline Green. It's really nice. Thank you for inviting me. Yeah, nice to be with you again for the last session.
Okay.
I'm academic lead for social work and social care.
Yeah. So this week really is the end of the course now. We've gone through the previous 6 weeks, and this week we're talking about the end of life care in dementia. And we specifically put this at the end, but only one unit, because actually most people living with dementia are doing exactly that. They're living with dementia. They're not dying, all at the end of their lives. And often that's quite a big misconception by the public, is that people who are living with dementia are all living in a terrible state, and it's not so good. Now, the reason it is in there is because some people are at the end of their lives, and actually we're all moving towards that final destination, aren't we? Not necessarily if you have dementia, but anyway. So it's a really important topic to discuss. It's something that we've already discussed this morning, actually, and it's very close to our hearts, and we're looking forward to talking about it with you, really. And I think I'll kick off this week talking, Timothy, I suppose, this kind of discussion board, and it was something which resonated with us and wanted to talk about. And Timothy said that this section is focused more on carers, as in family members, than elsewhere in the course. However, it's important that the carer is supported from the initial diagnosis. Healthcare professionals tend to forget about the carer and their role. More support and information, especially around non-medical interventions, or even local Alzheimer's branch or Age UK, at the same time where the carer is recognised too much strain can be put on this person, for instance moving and handling, which does well managed in a care home or hospital with training and equipment provided. And the carer isn't as often to get on with it. So we know that carers have a very difficult time, actually.
Yeah, I mean that was our discussion really this morning. I think we have to think about carers, the people who are left behind, and their emotions, how they're feeling, and I don't think we always do that. I think sometimes we just think about the person.
I think if we think about another environment, so for instance in intensive care units, often where people are very, very acutely ill with very complex medical problems or surgical problems, people who work there don't just treat the person as a person, they treat their person holistically, including their family, and often they nurse their families as much as they do the person. So it's all about clear communication and really being a supportive ear and talking with them and providing them access to support services, and that's happening a bit in this context, but not as fully as it can do, I think. Lots of hospices, for instance, have good support for family members. And
they're a very good environment, actually, where they are very inclusive of everybody. But I think sometimes it's afterwards, and it's a period of time afterwards. So I think everybody's very keen to get involved and support, be compassionate, at the time, and maybe for a short time afterwards. But then what happens, as time goes on? And I think people really need to be able to link into some support, somebody who would listen and, understand that actually, in terms of their emotions, things change and they may need somebody as time goes on.
And if somebody a couple are married, for instance, for 50 or 60 years, I mean, imagine a gentleman who's left alone by his wife who dies from whatever, it could be with dementia or something else. They've lived that person has lived their entire life with their wife, and suddenly to have nobody, or perhaps grown-up children who may have moved away, it can be very challenging for people who are left behind.
I think the loss can be really great, and I know I've worked with people and talked to people where they still feel that the person is there, and I think that's important to them. So they'll have a meal, they'll come to the table, they're still, and even talk actually to that person or feel that that person's there. Because imagine how can you just suddenly cut off from having that? And you go in to watch the television or whatever, and that person isn't there, but you probably do, or maybe need to actually still feel that they are there. But that can be a bit strange to other people when you tell that story and you say that to other people.
And somebody told me that somebody's never dead if people are talking about them and remember them, and I think that's a really nice thing. And
that's a nice thing.
I remember my mother died when I was quite young, actually, and but I was an adult. I was at university, and I remember watching a television programme soon after she died actually, and picking the phone up to speak to her to say, this is a great programme, you should watch this.
Yeah.
And as I was typing the number, I remember she wasn't there.
Yeah, you suddenly realise that she
and it hits you like a wave. And I imagine that must be what it is like for somebody who has lived their entire life with somebody, cared for somebody, done everything for somebody, to suddenly have someone no longer around anymore.
That's right.
There are support services available for people, of course, and carers.
Yes.
In Derbyshire, we have a Derbyshire Carers Association that is a good link for people to speak to people and speak to other people. There's lots of things to support young carers,
yes,
especially when people are a teenage, or at school, for instance, looking after. But I think we haven't got support quite right yet.
No.
I think certainly people who are in their 40s, 50s, 60s maybe, there is a strong pressure that they have to look after a person themselves.
Yes.
And I don't think that as a health system we're doing enough to support people. I think I would be really interested to find out what is happening around the world.
Yes, that's true. Yeah.
To give you the example which we talked about previously was in Africa, for instance.
Yeah.
And in places like Japan, which Yasu spoke about a couple of weeks ago, that actually most of care is provided by families.
Yes, that's right.
Because there are no formal support systems.
And then the families hopefully are very supportive, and I think maybe
And
in
that's
this
the
country
word.
the family isn't always there. They're all over the place. They've moved, so they're not all together as a family, and so that can be very
When it becomes a
difficult.
real
So
challenge.
people can be very isolated, can't they? The extended family might want to help, but they live quite away, and they're trying, desperately trying to support, but they're too far away because of their work and whatever else.
So thank you very much, Timothy, to raising that. Really, it's something that for raising that. It was really something which we wanted to talk about. So thank you.
Yeah.
So this is the final week from the course now, and this is really us saying goodbye, I guess.
Yeah.
And thank you for talking on the discussion boards, getting involved, and we've seen some absolutely amazing things that people have posted. Try and make sure, if you can to do your final assessment and make sure you get the certificate. Let us know if it's not happening, if it's not working, and we can help you sort that out. If you haven't already done so, make sure you get the badges throughout the course, and you can take those with you wherever you go. They're specifically designed for this course. That's really good. And the final thing I would say is we're doing some research, really, some academic research, to see whether this course is or has the possibility to see if it can change people's impressions and perceptions of dementia. So if you feel able to, and this is entirely down to you, is to participate in a survey, and I'll send a link out at the same time as this comes out about that survey. We'll also be doing that in about 3 months' time again as a repeat, just to see if those changes have been lasting. But you don't have to do that, it's not compulsory or anything, it's entirely optional. So finally, just thank you very much for joining us this time. It's been really great to meet you and speak to you and find out what you're all doing around the world to tackle this really big global issue, which is dementia. And I just hope that you take something that you've learnt, perhaps, and apply it in practice or somewhere where you are. It'd be really great to hear about those kinds of things. So thank you very much, and goodbye.